I am Dr. Sridevi KN. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. So when should you get a screening colonoscopy? So if you are somebody who is above 50 years of age and you have never had any symptoms, it will still be prudent for you to undergo a screening colonoscopy. As I said earlier, the incidence of cancer increases with the age. So if you are somebody who has crossed 50 years of age and who has never undergone a screening previously, then it would be wise for you to undergo a screening colonoscopy just to make sure that there are no lesions which could in future turn into a cancer. Second, if you are somebody whose first degree relative, that is, if you are somebody whose parent or sibling has been diagnosed with cancer or who has undergone treatment for cancer, then you should undergo colonoscopy 10 years before the age that they underwent their treatment. So for example, if you have a parent who had developed signs or symptoms of cancer at the age of 40, then you should undergo your first screening colonoscopy at the age of 30. Similarly, suppose you are somebody with not only a family history of cancer, but somebody whose familial cancer was determined to be because of a genetic reason, such as mutations in the 5th chromosome leading to FAP or familial adenomatous polyposis. So in this sort of conditions, you will be advised to undergo the first screening whether or not you have any symptoms at 25 years of age. That can be lowered, of course, if the first person to be treated was a much younger. So if the first person to be treated in your family or the youngest person to be treated in your family was around 15 or 20 years of age, then you will undergo the colonoscopy at that age or 10 years previously. Apart from this, who else should undergo a screening colonoscopy is patients who have signs or symptoms of colon cancer. If you have bleeding, if you have a mass, if you have a growth or any other symptom which your surgeon feels could be because of a colon cancer, then you will need to undergo a screening colonoscopy. So when we use the term screening, it usually means that you don't have any symptoms and we are just checking, we're doing a screening to see whether you have any lesions or no. So most patients with symptoms, it will be called a diagnostic colonoscopy. So if you are somebody who has zero symptoms but there is a risk of you having colon cancer, then we will call that a screening colonoscopy. Essentially, the test is the same. It's the reason why we do it will determine whether it is a screening colonoscopy or a diagnostic colonoscopy. So how do you test for colon cancer? How do you know if you have colon cancer? So now there are plenty of non-invasive and invasive ways in which we can determine whether or not you have colon cancer. And once we have confirmed that you do, then we can start the treatment. So there are blood tests, serum markers such as CEA, and there are imaging such as CT scan or an MRI pelvis which will pick up where the lesion is, how far it has spread. And there are some indirect methods such as stool analysis as well. But the most direct and the confirmatory test to say that you have a colon cancer is to do a colonoscopy and a biopsy. So once you do a colonoscopy, it will tell us the internal extent and the position of the lesion. And also once we take tissue samples from that, the tissue samples are extremely important for confirming not only whether or not it is cancer, but also which type of cancer it is. So even though it may look very much like cancer on an imaging, say a CT or an MRI can tell us that yes, it looks very much like cancer, we need a colonoscopy and a biopsy to confirm to us that yes, it is cancer. And not only that, there are several subtypes of cancer. So it could be an adenomatous malignancy, it could be a lymphomatous tumor, it could be a squamous cell. So there are many other types. Okay, so squamous does not apply to colon in general, but there are different subtypes. There are adenomatous and mucinous. So these separate types of cancers will tell us what treatment will work for you. There will also be other tests such as immunohistochemistry done to determine which chemotherapy medicines will work best on you. So the tests done to confirm whether you have cancer or not, there is only one, and that is colonoscopy and biopsy. A small polyp inside your colon and we don't know whether that has cancer or no. We may not just do biopsy samples from it, but we may remove the entire polyp itself and send that for biopsy. So that is called an excision biopsy, where we mark the site while doing colonoscopy and we remove the entire polyp and send it for testing. So in case it says there is no cancer, there is no further treatment required. But in case it says that yes, you do have cancer, then the site which is marked and a part of the colon around it needs to be treated apart from just removing the polyp. So a very common question asked is, how painful is colonoscopy and is it absolutely necessary for me to undergo such a painful procedure? So colonoscopy should not be an extremely painful procedure. However, pain is something which is very subjective and we cannot really comment on how some patients do not feel any pain during the procedure, but some patients do experience a lot of pain and bloating during a colonoscopy procedure. Preferably, all colonoscopies are performed under mild IV sedation to complete general anesthesia to make sure that the patient is comfortable during the procedure. So if the preparation, so the colonoscopy is done by first preparing your bowel. That means we give you some liquid or powder sachets to mix with the liquid so that your entire large intestine is cleared of all stools. So once that is done, if your large intestine is completely empty, once we add minute amounts of air into your large intestine to look at the lining, so that should cause a mild bloating sensation and not much pain. So what is the difference between hemorrhoids and rectal cancers? So it is completely different pathologies. So hemorrhoids is nothing but the tissue. It is part of our lining in the lower anal canal, and that provides a cushioning effect to our lining. So hemorrhoids or anal canal cushions are nothing but just that. They are part of our lining. Sometimes due to pressure or a lot of straining in that area, they can bloat up or they can swell up and they can cause discomfort. They can cause bleeding, they can get pushed out and cause swelling there, or very rarely they can slip out completely and stay outside, form a clot and become very painful. They can get thrombosed. So hemorrhoids is something that is a variation of the normal anatomy. So hemorrhoidal cushions are present in all patients, in all people, and in some patients they may develop into problems. Rectal cancer on the other hand is never normal. It is a pathology. It is something abnormal that has developed in the rectum. So it could be a growth, it could be a stricture, meaning it could be either something that has formed a swelling or it can be something that has formed a narrowing in the rectal area where the normal cells of your body have become cancerous cells. So this is not something that you are born with, but this is something that is formed at some stage in your life. And rectal cancer, again, it is very different from hemorrhoid in that rectal cancer always needs treatment. So it may be surgery, it may be chemo, it may be radiotherapy, or it may be a combination of all of these. But hemorrhoids does not always require treatment. Most of the time it is cured by just undergoing some lifestyle and diet modifications.